Septicemia. Septicemia is a serious bloodstream infection. It occurs when a bacterial infection enters the bloodstream from elsewhere in the body, such as the septicemia can quickly become life-threatening, and it must be treated in a hospital. If left untreated, septicemia can progress to sepsis. Sepsis is a serious complication of septicemia. Sepsis causes inflammation throughout the body. This inflammation can cause blood clots and block oxygen from reaching vital organs, resulting in organ failure. When the inflammation occurs with extremely low blood pressure, it's called septic shock. Septicemia is caused by an infection in another part of your body. Many types of bacteria can lead to septicemia, and the exact source of the infection often can't be determined. Bacteria from these infections enter the bloodstream and multiply rapidly, causing immediate symptoms. People who are already in the hospital for something else, such as a surgery, are at a higher risk of developing septicemia. These infections are often more dangerous because the bacteria may already be resistant to antibiotics. Others at a higher risk of developing septicemia include: the symptoms of septicemia usually start quickly. Symptoms may follow an injury, surgery, or another localized infection, such as pneumonia. More severe symptoms will begin to emerge as septicemia progresses without proper treatment. It's crucial to get to the hospital right away if you are or someone else is showing signs of septicemia. Sepsis occurs when your body has a strong immune response to the infection. It's called severe sepsis if it leads to organ failure, such as kidney or heart failure. People with chronic conditions are at a higher risk of sepsis. One complication of septicemia is a serious drop in blood pressure, which is called septic shock. Toxins released by the bacteria in the bloodstream can cause extremely low blood flow, which may result in organ or tissue damage. You'll need medications to increase your blood pressure. This is a life-threatening condition that prevents oxygen in your lungs from reaching your blood. Diagnosing septicemia and sepsis are some of the biggest challenges facing doctors. It can be difficult to find the exact cause of the infection. A doctor will evaluate your symptoms and ask about your medical history. The doctor may also look for signs of conditions that more commonly occur along with septicemia, including: the doctor may want to perform tests on multiple types of fluids to help confirm a bacterial infection. If septicemia is causing you to have breathing issues, the doctor may also look at the oxygen and carbon dioxide levels in your blood. If signs of infection aren't obvious, your doctor may order imaging tests to look more closely at specific organs and tissue. Septicemia that has started to affect your organs or tissue function is a medical emergency. Antibiotics are used to treat the bacterial infection that's causing septicemia. Bacterial infections are the underlying cause of septicemia. If your infection can be effectively treated with antibiotics in the early stages, you may be able to prevent bacteria from entering your bloodstream. If you already have a compromised immune system, the following precautions can help prevent septicemia. When diagnosed early, septicemia can be treated effectively with antibiotics. There have been many medical developments in septicemia diagnosis, treatment, monitoring, and training. Sepsis is a common cause of death for many people with chronic conditions, which helps explain the high percentage of deaths from sepsis. People with conditions such as dementia, Parkinson's disease, and amyotrophic lateral sclerosis, ALS, are at an increased risk of developing pneumonia and other infections, which may result in sepsis. If you develop symptoms of septicemia or sepsis after surgery or an infection, seek medical care right away. Sepsis is a serious infection that causes your immune system to attack your body. It is caused when bacteria get into your bloodstream, and it most often occurs after trauma or surgery.